the environment that diving creates, I think, is very unique, and it's given me a lot of parallels into my professional life and personal life as well. Because in order to be good at diving, right, you have to be able to be on the board. You have to show up, and when they announce your dive or you're practicing on something, you have to do it. Nobody else gets to. No one else gets to say, like, all right, tag in. I'm going to have my teammate do my dive for me. It doesn't work that way. And so it really taught this presence and being a part of a process and understanding, like, some things take time. You have to take it a step at a time. And hopefully through that process, if you're around the right people, like, it can turn into some really cool experiences.
That is Dr. Luke Weber, and this is the Well Mind Podcast. The Well Mind is a space for meaningful conversations about a broad range of wellness-related topics, with a special emphasis on our mental wellness. I'm your host, Dr. Ben Kohls. Welcome to the podcast. It's great to have you with me here today. Up front, I have a couple of updates to share. First is that I want to give a warm welcome to Matt Maish. He's the new editor working on the show with me. He's a student here at Bethany Lutheran College, and he is working in the studio in a couple of different areas, but he's going to be helping out with the podcast. This is actually his second episode. My conversation with Dr. Giordano, he also edited, so it's great to have him on board. He's doing a fantastic job. Welcome, Matt. Great to have you. Second is that I just got back from a trip to Arizona. Yes, Arizona in January. That was a good life decision. Okay. While I was there, I was able to provide a couple of presentations. I spent a whole day at the inaugural Men of His Word conference in Phoenix, and I just visited with lots of folks about the counseling program here at Bethany, what we're doing to train counselors and provide support for folks that way. I also got to meet a number of listeners to the podcast. So I just want to give a shout out to the Well Mind community in Phoenix. Thank you so much for listening. It was great visiting with you. I'll come back in January anytime. So it'll be good to see you again next year, hopefully. So, all right, those are my updates. Those are the things I wanted to share. Let's get into the show. On a snowy day in January, here in Mankato. Yes, most days are snowy here, but this was particularly snowy. Dr. Luke Weber joined me in the studio. Dr. Luke is an athlete, he's a coach, he provides chiropractic care, and he's just an all-around good dude. It's also been a while since I was able to have somebody right here in the studio with me, so that was a fantastic time as well. Just really enjoyed my conversation with Dr. Luke. During our chat, he speaks about his time as a collegiate diver, and he competed at a very high level. So it was really neat getting to hear kind of his story and about his experiences. And then we talk about how his life on and off the board has impacted his current role as a high school and college level diving coach. Professionally, he's also a business owner, and he provides chiropractic care through his practice at Kinetic Spine and Sport. We discuss our varying approaches to healing and helping, but really focus on the interconnectedness of our physical and mental well-being and how pain can impact both of them in a very interconnected way. Dr. Luke also speaks about how he sees himself as a facilitator when he's in that kind of a helping role. Just really fascinating discussion. Really enjoyed my time with him. I hope that you enjoy this as well. Okay, let's get into it. Here's my conversation with Dr. Luke in episode 30 of the Well Mind podcast, Facilitating Healing and Wellness. Dr. Luke Weber, thank you for coming into the studio today. It's wonderful to have you here.
Yeah, very excited to be here today.
You braved the snowy weather.
Yeah, as a Minnesota native, it becomes a norm. So it's just snow.
I know. Everything, the first few snowstorms, it seems like, that are like legit, everything kind of shuts down and people freak out. But by this time, everybody's kind of like, oh yeah, this is what it is.
Yep. Nothing new, same process.
Yeah. I know my kids were excited though to have some unexpected off time. They had snow days today.
Yeah, we found out last night when we were at the high school swim meet. So it's when we're trying to wrangle them up to help us clean the pool and they find out that they have no school tomorrow.
Yeah.
There's a different energy. So
different energy. Yeah, that's a good way to describe it. Yeah. For sure. Yeah. Everybody has a little bit of a different reaction, but yeah, it was difficult for the kids to go to sleep last night. And then I got up early this morning. I was, had to be over to campus pretty early, and 2 kids were already up, and I'm like, what are you guys doing? It's a snow day. And they're like, yeah, exactly. So they were like totally into maximizing their off time, and like they wanted to watch a show and like lounge around in their pajamas.
Yeah, good for them. I would say that's probably a smaller percentage of that population.
Yeah, well, they're the younger ones. The older ones, I'm sure, will maximize their sleep time for sure. Awesome. Well, we've got a few good topics for us to talk about today. You are a practitioner of chiropractic care, and you also are an athlete and a coach, and you were talking about the swim team, so we'll get into that a little bit today. But really the focus, for our conversation is going to be around holistic wellness, and the fact that you specialize in practice specifically on physical wellness. And for me, coming from wellness from a psychological perspective, a mental health perspective, that there's actually a lot of overlap between our two fields in terms of attending to our emotional and mental wellness and attending to our physical wellness. And when things are off in one area, it's probably impacting the other. So I'm just really excited for this conversation. I think it's going to be great, and appreciate you taking the time to be here. So with that being said, help us get to know you a little bit more, Luke. Tell us about yourself, kind of where you've been, what's kind of brought you to this point, and a little bit about what life is like for you right now.
Sure. Yeah. Again, thank you for having me today. Very excited about it. My name's Luke Weber. So in the walls of my clinic, I guess I go by Dr. Luke or Dr. Luke Weber. I'm the current owner of Kinetic Spine and Sport, which is a chiropractic clinic. So that's kind of the today. We got here by being born in Mankato 30 years ago. So I grew up in the area, went to high school at West. So graduated as a Scarlet. We're still friends with everybody else. So I just like to throw that out there.
Yeah, there is, for non-Mankato people, there is a little east-west thing that goes on in town.
Yeah, that is correct. So it's a fun community dynamic. But so went to West, was in a bunch of activities, sports. I was a choir kid. I was in the musical one year. My parents were very big on just diversity of stuff. So my mom's a kindergarten teacher. So I think my teaching background from her. My dad's a plumber. He just retired last year after 40 plus years in the trades. Yeah. So did that, was a small business owner for a while. And I think some magical combination of things when you combine those two careers, like chiropractic kind of really fits in the middle. It's a service type of thing, but it's also a big education thing. And I knew from a very young age that I wanted to do some type of patient care. Always interested in health. The human body is outrageously fascinating, from the physical to the psychological to the human experience. So after high school at West, I went to St. Cloud State. So I went there to continue my academics and also be on their men's swimming and diving team. So once I kind of got to the end of my high school career, I was kind of, I guess, late to just even thinking about the college adventure. And then once people started asking about, like, do you think you're going to keep diving? I was like, what do you mean? I get to keep diving after high school? Like, high school sports are just high school sports. But was fortunate enough to get recruited to go there. And after my very first visit, meeting with the coach the very first time, her name's Tracy Torgerson. So I knew I got home. I called my friend that was also on the recruiting trip with me and said, I'm going to say yes today, just so you know.
Wow.
And we went there and had just 4 incredible years as a student athlete. Finished my biomed degree, kind of a standard pre-professional degree is kind of what I tell people. And then after that, went to Palmer College for chiropractic school.
Where's that at?
That is in Davenport, Iowa.
Davenport, Iowa. Okay.
So when you kind of talk about the first snow day for things, my first year down there, they had some record snow, and me and my little 2-wheel drive car was going around town just fine, and I couldn't figure out why everything was shut down.
Mm-hmm.
But that's just a gift that we get to live in up here.
Yeah.
So
Yeah. No big deal for us.
yeah, exactly. So after 4 years in chiropractic school, finished up my internship, ended up working in northern Minnesota at a clinic for a couple years. Had a great experience, just kind of getting your foot in the door as a professional. And then after that, I worked a couple years in the cities. And then at the beginning of this year, this great opportunity popped up. And I always knew that I wanted to come back home. Mankato was always home. I still have family around here. And it just literally came out of left field and kind of jumped at the opportunity.
Yeah. Yeah. So it wasn't something necessarily that you were pursuing at that point, but you were open to that possibility and it presented itself.
Yeah. So I was working with my uncle up in the cities, and I was on kind of a 2-year contract, which contracts and stuff aren't things that you learn about at school necessarily.
Okay.
But we got towards the end of that, and we were both, the clinic was being successful. I felt as an individual, I was growing a lot. I was learning a lot. And part of that process is also learning, is this the right fit for you?
Yeah.
Or is it not? Because something can still be great, but also not be the right fit.
Mm-hmm.
And so we kind of had an end of the year conversation, and I let him know, like, really appreciate my time here. This has been an incredible experience. Long-term wise, I don't think it's the right fit. And I hope we can kind of figure out what that next transition looks like.
Mm-hmm.
He made a phone call to talk to one guy that evening. I called the guy the next day. We got lunch 3 days later, and the clinic purchase agreement was already in my hands.
That's amazing.
Yeah.
Yeah.
Kind of a mind-blowing experience for me.
Yes. And so now you are a small business owner. Like, there's that kind of full circle with your dad too.
Yeah. Which I think one of the interesting things for me is that was never a part of my plan. Going through kind of a profession of, again, patient care and service, I always thought my 100% of my energy is going to be on my patients.
Yeah.
I don't want to have to worry about running a business. I want to be able to do my job, do it well, and let that take care of things.
Okay.
But then it got to that point of finding, where can you do that? What's the right fit? And if you can't quite find the right fit, then you get to create it. And that's kind of the stepping point that I got to.
Yeah, that's so interesting, because when I was going through grad school and my master's program for counseling, I had this picture in my head that after graduation, kind of the thing that I would be aiming for, and it probably wouldn't happen right away, but I would end up there, would be owning my own practice and being in private practice. And like, I thought, oh, well, that's kind of like the pinnacle. That's exactly what I want to do. And then I interned my second year in my master's program in a private practice. So single provider practice. He had his own office space where he would see clients, and then he had some satellite locations that he would travel around to, because it's in southern Minnesota here. And I looked at everything that he had to do, and then I said, no way.
Yeah.
No way. I do not want to be in charge of like managing all of those just administrative business pieces. And I'm like, that's not the brain that I have. I was like, okay, patient care, right?
Yep.
So then that's where I have spent the vast majority of my career, whether that was in a hospital system or a nonprofit agency or residential treatment, those kind of things. And I'm like, wow, that's great. But so I admire you for taking that step into what's essentially the equivalent of private practice, for a counselor. And I just think it's fantastic. And, you're doing a great job. I mean, obviously I'm biased here, but,
Sure.
but I think the clinic that you're running is a wonderful service to the community.
I appreciate that. Yeah.
So talk a little bit, let's backtrack. How did you get into swimming and diving? What's the origin story there?
Yeah. Well, it's not an everyday sport. So,
Right. Yeah. And even the fact that it's at a high school is less common too.
Correct. Yeah. And I think like our high school in town is pretty big. It's a decent size, right? We have classes between 300 to 400 or more. And even people at the high school didn't know we had a diving team.
Yeah.
And so I played basketball and hockey forever growing up. And then I just kind of had two incidences where I just wasn't having the experience that I wanted. And through baseball, which is another outside sport, one of the parents was like, hey, we heard that Luke goes to Turtle out over the summer, the public pool. He seems to like to jump into the water because my mom used to teach summer school.
Oh, okay.
And she taught at Franklin and her school is right next door. So you could either pay for daycare and send me there, or you could buy me a pool pass and I'll learn a little independence.
Yeah.
And so I was there for, I think, 2 summers, 5th and like 6th grade before you could even join the swim team. And then 7th grade rolled around and they're like, yeah, give it a shot. So I kind of walked into this totally unknown realm, never went to a swim meet ever.
Okay.
And it just ended up being one of the most impactful places in my entire life. Like starting in 7th grade, because for diving, at least in the Midwest, we can't dive outside year round.
True.
Right.
Today is a testament to that.
Yeah, exactly. And I think where diving has a bigger presence is down south or on the coast.
Yeah. That's typically what I would think of as swimming and diving is coastal schools.
Yeah. And so it was just out of the norm, but the environment that diving creates, I think, is very unique. And it's given me a lot of parallels into my professional life and personal life as well. Because in order to be good at diving, right, you have to be able to be on the board. You have to show up. And when they announce your dive or you're practicing on something, you have to do it. Nobody else gets to. No one else gets to say like, all right, tag in. I'm going to have my teammate do my dive for me.
Sure.
Doesn't work that way. And so it really taught this presence and being a part of a process and understanding like some things take time. You have to take it a step at a time. And hopefully through that process, if you're around the right people, like it can turn into some really cool experiences.
Yeah.
I never would have thought like I went to Hawaii because of diving. I went to Texas because of diving.
Okay.
I went all over the place and never, 7th grade Luke had no idea that would have been a thing.
It opened a lot of doors for you.
Yeah, big time.
Yeah. I think my guess would be the majority of people think about diving about once every 4 years.
That is correct.
And I know for myself, I enjoy watching diving at the Olympics. But what stands out to me is the level of precision with diving. Even more, obviously, the swimmers. I love watching the swimming as well. And I have some experience with that as a triathlete and training. And so that seems more accessible to me, but diving seems to be this really precise, elite, kind of exclusive group of people that are able to find success or find, like opportunity in a sport like that. Am I right at all, or am I totally off on this?
I would agree with you. I think one of the cool things about diving is in my mind, it takes everything. You can't just be able to bench press 400 pounds. That doesn't make you good at diving. You can't just be super fast. You can't just have like this one skill that you really lean on. You have to do it all.
Yeah.
And within the sport of diving, there's 5 categories typically in a standard meet. You have to be able to perform all of them. So it doesn't let you hide any weaknesses. And I think that's a very unique thing in sport, right? Like I play baseball. I still play baseball, or at least try to. But like it's one of those sports where if you throw hard, you can be a pitcher.
Sure.
You don't have to be in great shape necessarily. You don't have to be fast. You can hold on to that one skill and run with it.
Yeah.
Diving, you don't have that option. If you want to, what I would say, get to your potential. You have to be able to find a weakness and work on a weakness, and then also learn how to manage that with your strengths.
It seems like there's so much pressure on those divers. I mean, some of them look completely relaxed. Again, I'm referencing the Olympics. That's the only time I have seen diving in a professional sense. But there are some athletes that, they don't smile. They don't, it's like they get up, stoic, do their dive, get off, they go to the shower, and it's like almost like mechanical in that sense. And then there are others though that seem very loose and relaxed, and they're joking around with the other divers and things like that. But when they're up on the board, there seems like so much pressure up there. Like everybody's paying attention. You have like a split second to do this thing, and it has to be perfect.
Right. Yeah. I think diving taught me about stoicism before I knew what it was. And I've been doing a little bit more reading lately in life. And that's been one of the big topics. And I think why it connects so well is that it creates kind of this, to me, diving can be kind of a chaotic space. There's a lot that can go on, and it all comes back to what can you control?
Yeah.
I have to be able to be calm enough to be in tune with my body, to be able to connect with the diving board and get it to do what I want it to do. And I have to do it in a way that also objectively looks good. And so there's things that are in my control, and then there's also things that are out of my control. And one of the biggest steps for me, I think, was when I was able to separate those. Everybody wants a high score. Like that's just normal.
Yeah.
But if I do a dive and I get a wide variety of scores, I have to be able to accept that that's their opinion, right? I can't let that waver one way or another, because chances are I have to do another dive in like 10 minutes.
Yeah.
And it doesn't help me. It doesn't serve me at all to go on this roller coaster when I still have to go through my process.
An incredible amount of mindfulness is needed, it seems like, in what you're describing. So I don't remember if you've said this yet, but you're coaching now, right? So now you're in a position where you've been there, you've competed at these high levels collegiately, and now you're coaching and trying to train. Is it men and women that you coach, or just a men's team, or what is it?
Yeah. So I get to work with a really cool spectrum right now.
Okay.
So I volunteer up at Mankato State with the women's team. So the college, I'm there a couple days a week. And then I'm also the boys high school diving coach.
Okay.
And so I get to work with as young as 6th graders now. That's kind of a new thing this year, but I go from working with 6th grader boys, which is their own population,
for sure,
to college young adult women, which is also their own population.
Yeah.
And it's been a really good eye opener in understanding, like, I can't connect with each of them the same necessarily. We have to be able to accommodate and create different things that's going to connect, that's going to be effective in each of those.
Yeah, but you're still having to teach that, like, stoicism and mindfulness and presence and being able to let go when bad things happen, or not get like too excited when you have a great dive, because you got to focus on the next step. So what are some of the tools or mechanisms that you're using to, I guess, nurture that whether it's the 6th grade boy or the 20-something, collegiate athlete.
Mm-hmm. What I found is a lot of that is just understanding them as a person first. Everybody's going to respond or react to things differently. We hope to get responses typically over reactions, right? Because then there's a little bit more of that mindful process to it. But when I've been able to just pick up on patterns from people and say like, hey, when maybe if I was a little more excited with this person, they were able to be more connected to that versus, hey, this person really succeeds in a calm environment. How can I, as a coach, create those differences for each of them? But then when it comes to, we'll go back to like the stoicism again, we still want that at its core. So you end up developing like core values as a team, which is something that we do at the college pretty frequently throughout the year, which I think is super helpful. But getting people to understand these are big pillars of what we're going to do. But if we can do that, then that allows us the ability to be flexible with the individuals. And that's a very good parallel to clinic work too. Of like at my practice, we have very strong pillars of certain things that we think are important to health, but we also have to be able to accommodate that to somebody else and figure out where are they at in that process.
Yeah. I mean, so you're operating on a shared foundation, but recognizing whether it's the athlete or the patient in the clinic, like they have their own individual needs and experiences. And so it's not about fitting them into a certain mold, but working with who they are, probably where they're at, whether it's developmentally, their stage of life, the presenting concern, whatever that might be.
Right.
Yeah. So there are a lot of parallels here. I just think it's so, again, that the sport of diving is fascinating to me because I know enough to recognize that there's so much going on there in the moments preceding, during, and after, a dive that it's what you see doesn't probably represent the wholeness, the totality of the work that person has put in to get to that point. And you're confirming a lot of that today, that this is you're building over time in all of these areas to strengthen all of them. And that's what makes somebody at least gives them the opportunity for excellence in that sport.
Yeah. That phrase of opportunity for excellence, I think is a huge hitting point for that. Because you have to earn it at the end of the day. And I think one of my favorite parallels, again, from diving to professional career work is I did an interview for an internship one time, and the clinician was asking me, how do you do with criticism? Are you coachable? And I probably should have thought a little bit more about my answer, but I told him, I was like, well, I just spent the last 10 years of my life standing on a diving board in front of a crowd, wearing my swimming suit, having to follow instructions and be successful at it. And, and here are the things that I've been able to accomplish through that.
Yeah.
And he, because he was also an athlete, he's like, I get it. And I think that gave me a really good foundation for that, because there's a lot of pressure in those situations, whether you're doing a hard dive or you're doing a new dive, or the competition is close, or there are, national championships on the line, whatever it may be, you feel that pressure. And then you learn to control, to succeed in it. And, I feel a similar pressure in clinic. People come in and they're hurting and they're looking for something, some type of service, some type of hope, some type of whatever. I also have to keep my cool there, because if they come in with whatever they have going on and I lose it, we're probably not going to get very far.
No. All right. So last diving thing, at least for the immediate moment, and then we can transition into the clinic. But I just am very curious, what is it for you, or what has it been for you when you're preparing yourself to go out onto that diving board before the dive, to center yourself or ground yourself? Like, what is it specifically that you would do, that you'd be willing to share?
Yeah, sure. Yeah, great question. For me, my biggest thing was getting back to just remembering like, this is fun. Like, it's super hard. This is one of the, I would say, the best challenges or the challenging environments that I've ever been in. But when I reflect back on all the different things that it taught me and the different people that it connected me with, at the end of the day, it's fun. And I just have to stick to my process, stick to my controls, and just put forth the effort. And it's interesting that you bring up like when you look on a pool deck of people, huge spectrum of how people approach things.
Yeah.
And there's no right or wrong. Like there are some people that they can't sit down. They're literally dancing nonstop, listening to music, talking to people. And then they hear their name, they sprint to the board, they run up and they do a great dive. There's other people that are in a corner under their towel with probably not even headphones in, but just earplugs. And they are as quiet and in their own world as they can be. They can walk up to the board, do a fantastic dive as well. Yeah. And so it really teaches that personal connectiveness of you need to know where you are in that moment. And I remember like my last meet in college at our NCAA championships. Usually I'm a pretty, I wouldn't say high energy person, but I'm talking to my teammates, I'm connecting with people, I'm cheering with my opponents because our diving world is so small. And I was in that meet and something just said, just stay quiet, just stay calm for whatever reason, but this is the right thing for you to do right now. And it wasn't totally out of my norm, but it was just a different presence. And it was cool. Like it worked, even though it wasn't necessarily my automatic thing.
But you responded to something in the moment that a felt need, a perceived need, something. And that, I mean, that only comes from a practice of just regular self-awareness, regular self-monitoring, like attending to what's going on physically, mentally, emotionally. And that doesn't happen by accident, right? That's an intentional practice. So by having that practice that allowed you to tune in that moment to what specifically you needed and you listened and you followed through on that. That's pretty cool. And I think that's a good segue into us talking about the professional aspect of what you do with chiropractic care, because we need to, that's a practice for health and wellness, is that we need to be able to check in with ourselves. We need to be able to monitor ourselves physically, emotionally, mentally. And, we were talking before I hit record here, and I said, my assumption that I want to check out with you is that people come into the clinic because something has gone wrong and they can't ignore it anymore. I think, we're generally more apt to avoid and ignore things for as long as possible, especially if it's going to be disruptive to just what our plan is or what the day-to-day structure is. But then when we experience something that is debilitating or exceedingly painful, that's when it kind of propels people to seek out care, to seek out services and those kind of things. And you were kind of saying, yeah, that's usually the gateway. People walk into the clinic and something has gone wrong. Can you talk just a little bit about that kind of initial engagement piece?
Yeah, for sure. It kind of the paradigm that we were talking about was a reactive versus proactive approach to things. And we know us as humans, we love our habits, we love our patterns, we love our day-to-day that doesn't change. And when something more or less forces that to change, that's hard. And that's, I joke around with some of my patients, but one of the things that brings people into my clinic the most isn't because they're in pain, because they can't sleep. And for the most part, we all need sleep.
Yeah.
Whether you want to admit to it or not.
Pretty important. Yeah.
And so I always found that fascinating of like, well, sleep isn't the problem. It's this pain that we're, enduring for whatever reason. And that is causing this ripple effect. So why didn't we just address that? Why did we have to wait until now it's starting to knock down all these other dominoes in our life that we don't like? And so I think the first step that I end up starting with a lot of patients is just awareness and how powerful that can be. Because when we let the human body just kind of go into autopilot, and I think, I guess this is my assumption, this goes from the physical standpoint, but also the mental and emotional. It can run on patterns all day long. And it may not kick out whether that pattern is good or bad right away until we get down the road. And then all of a sudden we find ourselves in this place that isn't good, whether that's because of pain or some type of mental health thing.
Yeah.
And now we want it addressed. And so when I try and kind of help people open their eyes and be more in tune to that, that allows them to better evaluate their situation, hopefully make better decisions for themselves, and just steer towards a different path. And my favorite thing with that is they get to do that. I don't have to be in the middle of that. When I can help people develop that skill and that understanding, now the power is in their hands. And I think that as clinicians, regardless of what realm you're in, is one of the greatest, whether we want to call it a gift or a service that we can provide.
Yeah.
That's one of the best things that we can all do, is teach people that empowerment, that independence for things.
And that's incredibly scary for people too.
Big time.
I mean, I've a lot of what you just said resonates with me as a mental health professional too, because people don't come into counseling when things are going super well for them, right? I mean, that's the reality of it, and that's the paradigm that we're in. And I think it's in the U.S. because we have such a medical model that focuses on pathology and symptom reduction or alleviation. Like that's
for sure.
You go in, you fix me, or you do something, and so that I can go back and keep doing what I was doing. Yep. So, and quote unquote, living my life. But when it's real challenging at times when clients come in for counseling and things are not on a positive trajectory in life, but the only initial focus, at least, is on how do I cope with this? Like how do I just manage this so that it is less problematic, and then I can continue. When the reality is what we end up often talking about are trajectory changes. Like new behaviors, new ways of relating, new ways of thinking that are going to put them on a trajectory towards health and wellness. And that means kind of letting go of or giving up certain things that, well, it's just the way it's always been,
Right.
patterns in their life. And I got to imagine from a physical standpoint, when somebody comes in, just based on what you've said, it sounds like there's a parallel there. It's like, Dr. Luke, get rid of this so that I can sleep,
Correct.
right? But not really looking necessarily for input or consultation on what other changes they might need to make in their day-to-day life physically so that they can have better sleep. Is that
totally?
Yeah.
Yeah.
How do you bridge that gap? I'm just curious, from one professional to another, like how do you bridge that?
I guess what I try and really do is, one, share the facts with people, because we all have ideas of certain things. We all have perceptions, past experiences that shape how certain things impact us. And some of those aren't always rooted in fact, or, what I would just say is an educated understanding of it. Yeah. They're rooted in, maybe someone else's ideas. And the crazy thing about the human mind and the human body is we can grab onto those and make it a real thing. And so, if you ever want to see me make like a really sour, uncomfortable face in practice, have someone say, "You healed me," and just watch like my visceral response. Because that's not how it works. Yeah. But that is still the approach that some people have. And I could probably handle it a little more gracefully when that comes up, but I try and really slow them down and be like, that's, I'm just trying to open a door or an opportunity for you to heal, for you to get better, for you to make better decisions. I'm a facilitator. My hands aren't magical. I wish that they were. That would be cool. But at the end of the day, that's not how it works. And so when you really get people to understand kind of those intricacies, you slowly see their mind shift and their perspective shift. And one of the best things for me as a clinician, like when I have a patient that comes in and says, hey, we had this conversation about this. When I approached, we'll just say a training session, initially, this is what I did and this is how my body responded. After our conversation and just learning through that a little bit more, I had the same situation pop up. I handled it differently based off of my understanding, and my outcome was very different in a positive way. Mm-hmm. That is literally the best thing that I could hear.
Yeah.
Because you shape that understanding in a place that hopefully is more truthful. At the end of the day, that's kind of the goal. But is also more empowering again, kind of that same topic.
Yeah. Yeah. No, I like that. It just comes back to informed, educated knowledge is really about, it's equipping the person to then be able to make choices and discern for themselves. Okay, well, like now I do have a choice. It's not, this is the way I do it, or I don't do it. Right. But here are some alternative pathways that I consider. And I'm sure, just again, knowing you establish a good working relationship with that person that's built on, trust and respect and those kind of things. So then say, okay, well, if Dr. Luke is kind of encouraging me to approach it this way, or do these exercises at home or something like that in between treatments, and I should really try and follow through on that, and that in some ways, a lot of what counseling in terms of what the outcome of counseling is, a lot of that's based on the quality of the relationship between the counselor and the client.
Big time.
And it just seems like, again, there's another parallel in your practice.
One of the notes that I wrote down when you sent me those questions was, I think one of the obstacles that our medical system has is the relationships between, I think, a lot of clinicians, again, regardless of realm, and their relationship with patients is just very thin. And it's hard to have an impact when the time isn't there, or the being able to mold to what that patient needs. And it kind of goes back to why I ended up in private practice. Like I ended up finding a place where we could create that.
Yeah.
And kind of circling back to when you mentioned, like, we get in situations sometimes where, like, the patient's focus is, how can I cope with this? Right? They don't necessarily want to change a trajectory or something like that. Something that's super interesting to me, let's just say they're dealing with pain, because that's an easy topic to bring in. There are some times where you do have to focus on the pain. You can't just say, like, hey, this exercise is going to make that better. Hey, if we do this differently, that's going to make it better. If, we can't always take that big jump first. Sometimes we have to just create an environment to let, I think of it as like turning that volume down, so then they can take that next step. And I think that's just a challenge to know when do we hit the gas, and when do we go, and when do we push and encourage them? And, when do we hit the brakes? When do we really stop? We just be present, more so cater to what they think they need, even if we know long-term that might not be the best route.
Yeah. Yeah. No, and you're absolutely right. And I'm not belittling or negating, like, the importance of being able to cope with and manage.
Right.
And
it's a skill.
Yeah. Yeah. You have to have that. And here's another point as you bring up pain, like, pain and wellness are on two different lines, I think, because wellness does not mean the absence of pain.
Correct.
Right. Well, wellness has a separate definition that I think is, we can talk about that from a holistic standpoint, but pain is something that is also a reality in our life. And at times the volume is turned up on that pain. And then there are times when we can turn it down, or life turns it down, and that's great. But that is like independent of our overall wellness.
Yep. I think that's a huge thing for people to really understand. One of kind of an example that I use is like, if we didn't have pain in life, I don't think there would be as many of us around, because pain ends up usually, well, let me rephrase that. Pain ends up being a good indicator of something that maybe we shouldn't do. And it's a protective mechanism. Sometimes it is right. Sometimes we shouldn't do it or bad things happen.
Yeah.
And so that skill comes around to like, one, understanding, why is my pain volume where it's at? Can I attach it to something, or can I at least look at all the factors that go into that and try and understand, what is my body telling me? And then once you kind of have that understanding, then it shifts over to, okay, how can I control that? How can I manage it? Because pain in and of itself, not a bad thing. It's not a negative thing. It's a part of how our body functions at a very high level. I think it just ends up getting a bad rap because of the perspective or how it's, utilized or expressed.
Yeah. Yeah. One of the guys that I have run with, we've talked about this, and, the reality is if you're pursuing any athletic goal or effort, at some point injury is going to be a reality. Like, you will get hurt. And whether that's, overextending yourself or pushing too hard, or it's just a fluke. I mean, that's a reality. So we always talk about like pushing through effort-based pain is a productive thing. Like that's going to we talk about like chiseling out the pain cave, like making more room in there. And so pushing through effort-based pain is good and productive. And but pushing through injury-based pain is just stupid.
Yeah, sometimes.
to put it bluntly, like if you're hurt, and you're trying to push through that in order to keep, you're probably doing more harm than you are any good.
Yeah, I would say I wish it was that black and white, right? Like we all would.
Yeah.
It really comes down to understanding the difference, and then also understanding that when it comes to pain, sometimes our body's wrong, and it is just there because of a pattern that our body's developed, and we have to fight through it. And that all starts with having that awareness of like, have I felt this before? Have we been in the same situation before? Am I just deconditioned to this thing? Is this new? Can I not tolerate it? And really knowing where you are on that spectrum. It's like you look at, you see videos of like old karate people like punching trees, and they do it without wincing once, right? You think the first time that they punched it felt good? Probably not. No. But they understood that process. They understood, I can condition my body. I can develop a tolerance to this where this is not going to have a negative impact on me.
Yeah. Yeah. And it's a building process for sure that happens over time. But so let's kind of dive into this a little bit deeper. No pun intended.
Yep, absolutely.
So when you're seeing somebody and they are experiencing, pain and discomfort, and maybe there is like an injury involved, whether that's in their back or skeletal system, muscular system, but you are also, you're making an adjustment or you're doing some other soft tissue treatments or something like that. There can be pain and discomfort in that too.
Sure.
And then when you're telling them, okay, do these stretches or these exercises or, this PT type thing, like there could be discomfort in that too. So how do you, how do you coach or kind of educate people to say, well, what's productive? And then when does it flip over into something that isn't productive?
Sure.
I know that's a big question.
Yeah.
And it's probably, I know you're going to say, well, it depends upon the person and it depends upon the situation, but I want to go a little bit further than that. Like what principles are you trying to apply in those situations is what I'm asking.
Sure. So I try and break it down into like 2 learning periods of like, let's just use low back pain, for example.
Yep.
Say
Very common.
Yep. Say we hurt our low back shoveling, which I'm sure will happen today to a couple people. One thing that I gauge it with is how does it feel when we're doing certain activities, right? Like, okay, I hurt my low back. Now when I bend forward to put on my shoes, I get low back pain. That in the moment sensation is really good information in terms of like, how are we progressing, right? How it also feels afterwards, because we've all had delayed muscle soreness, delayed discomfort from things, right?
Yep.
Is kind of this second phase, the second period of how is my body responding outside of that moment. It's more of like a processing pain. And that's one of the things that I try and get people to understand. So like bringing it back to a treatment. Say we're working on just restoring normal range of motion, desensitizing some pain that we know is just very protective. If we know that the pain in that treatment is kind of because of those things, we're able to kind of talk our way through being able to tolerate through it. Mm-hmm. But if someone is laying there and I push on their low back and that hurts and their only understanding is pain is bad, they're not going to do a very good job of relaxing and kind of letting us work through this treatment, right? So that's kind of how I'd coach people through that moment. But we also have to establish boundaries.
Yeah.
Where we also know that if we're doing a therapy and it's hitting such a high pain marker for them that they're not able to control it, they're not able to stay present, they're not able to do those things, that could be beyond us getting benefit from it. That could end up being negative, because pain is one of those things where if the volume is on and you keep hitting that volume button over and over and over again, now it becomes a pattern. And we need to know when we're reinforcing it in a positive way of like desensitizing or building that tolerance, mm-hmm. and when we're literally just hitting pain and making pain.
Yeah. No, that's that. Oh, man, there's just so many overlaps too from like a mental health standpoint with what you're talking about, because I mentioned my perception is that we're really good at avoiding and we're mm-hmm. really good at trying to ignore things. So whether it's physical pain or whether it's like a mental health or emotional issue, I think it's like there's a tendency to just like avoid that. So mm-hmm. I'm sure you have worked with people and they've developed some workarounds because maybe they have mm-hmm. pain with something. It's like, well, I can't do that motion or I can't move in that way mm-hmm. without there being pain. So I just don't do that at all. And,
right.
What ends up happening is that I'm sure that there's then some weaknesses that develop as mm-hmm. a result of that, mm-hmm. That becomes harder then for them to overcome. And it's the same thing from a mental health standpoint. Like I have things that bother me. Maybe it's anxiety. Maybe there are, we'll just stick with anxiety, triggers that induce my anxiety, and I just avoid those. But then I'm like kind of cutting off a whole part of maybe my life,
mm-hmm.
Whether it's that social relationships or performance-based activities at work or at school or something like that. It's like I just don't do it because I'm uncomfortable, because mm-hmm. I'm anxious, right? And right. It's the same thing. I just don't do that because it's painful.
Because it hurts.
Yeah, it hurts, and I don't want to do that. So it is kind of like a gradual exposure and kind of working into that mm-hmm. I like that word tolerance, kind of building that tolerance for the discomfort.
Right.
I think with the hope though, that it's not just that you get better at tolerating it, but that eventually that pain does diminish as well.
Yeah. And that brings up one of the points of like, we have to remember that our body is structured to heal. And as long as we understand that and we respect those things, it's going to continue to do it because that's how it's wired. Mm-hmm. Like we'll use your running as an example. You go run a marathon. If you get up the next day and try and run a marathon again, it's probably not going to be the same, right? Mm-hmm. And it's because we haven't had that healing time, that healing process. Some people can, right? There are outliers.
Outliers. There's a very fraction of a percentage of people that can do that day in and day out.
Yeah. But I also get people to understand that about healing from an injury. So before I even treat anybody, one of the things that I really like to tell them, so we'll use low back pain as an example.
Yeah.
Let's say it's non-specific. They hurt it shoveling snow. As long as we respect those healing boundaries, chances are their low back pain is going to get better in the next 2 to 6, maybe 8 weeks, even if I don't do a single thing, because that's how the body works.
Yeah.
But my goal is, how can I enhance that process? Can I make this healing more comfortable? Can I make the healing happen in an environment that's more tolerable? They're able to get back to their things sooner. And some people, when I tell them that, they're like, well, I don't have 8 weeks for this to hurt. I'm like, that's not the point I'm trying to make. What I'm trying to make is, as long as we understand it and we make smart choices, this doesn't need to turn into a long-term thing. You don't have to need me to get through this process, but I'm here to help.
Yeah. I love it. So let's move along that continuum of health and wellness. And we've talked a lot about pain and pain management and healing from injury, healing, from pain, tolerating pain. But then as we move towards that other side of the spectrum, where we're trying to promote our health and wellness through specific, activities, regular kinds of things. This falls in line with, paying attention to my diet and making informed choices nutritionally, and then exercising and doing that from an educated. Where does chiropractic care kind of contribute, or where does it fall in that area of promoting and sustaining a person's wellness?
Sure. So at the basis of the chiropractic profession, I think we really are based in wellness and holistic health. That's kind of what it's founded on. It's just, we also work really, really well in the pain management world. So it kind of puts us on both ends of those spectrums. But I think it fits a little different for everybody. But I think one of the ways that it fits, like if I look at my population of patients that come in because it's a part of their health routine, I think one of the most advantageous parts of that is it gives them a space to check in. It gives them a space and somebody hopefully that they trust, where they're able to say, here's what my last month has been like. Here's been my training. Here's been some of the other things going on in my life. This is how my body is responding to that. And kind of back to the coaching thing, my goal is, can we identify whether we're going on the right path or on a good path? Are we getting the things that we want out of that month, or do we need to modify and make some changes? And I think that, like, I'll never be able to say, hey, we saved you from having low back pain, or hey, we saved you from X, Y, and Z. Like, we can't do that. But what we can say is, hey, we continued to learn through this process. We continued to manage some of these situations or opportunities, hopefully better than had we not had that education and understanding. And we may not even see all those benefits, but when you reflect back, you think, okay, that was I managed my health really well over the last year. And that, and right now it ends up being an interesting topic because of the world setting, where health now has a spotlight on it a little more than normal. But I think that check-in is super good for people, and also a time to just slow down, connect. One of my other favorite things about my practice is people will come in and they'll say, I know you're a chiropractor and I know you do like bones and joints and muscles and whatnot, but I have a weird question. And I sit down in my chair and I get my whiteboard out. I'm like, bring it on. Let's do that. And like, I guess one of those examples is like, I talk about women hormones and menstrual cycles more than I ever thought that I would have. But it plays such a huge part in people's health.
Yeah.
And they might not have a place to talk about that. And if I can act as even a first step or an open door for them to ask the question, maybe I can help them or guide them in the right direction. hopefully we just increase their chances of getting to the right person that can help them with that. But what's so hard about our healthcare system being so reactive is no one goes in when things feel good, when they just have a question, because it costs how much money?
Sure.
And it takes so much time, and it does all those things where we get to work as kind of this little hub of like, here's a checkpoint. Come in, do an audit of yourself. Let's see if we have any questions and if we have to navigate or not.
Yeah. Well, and we've been talking about another continuum of like reactivity to then moving into a place where you're able to respond to things. But now what you're talking about is that proactive side where, this is something that you have worked into your routine, have worked into your wellness plan, and say, okay, these are my touch points for my physical health, and then from my standpoint, like these are the touch points for my emotional health and my relational health and those kind of things. So I see that, a clinic like the way that you run yours really does invite people to be able to have those touch points in whatever level of frequency or intensity or whatever it is that they want to do. But it's an opportunity, and I'm sure, again, because you establish those relationships built on trust and respect, that you have folks bringing all sorts of things to you that are not specifically chiropractic related. Yeah. Even though, it's all interconnected.
Yeah. And that's another thing that I guess the way that we try and educate everybody is there is all that overlap, right? And so when you open their eyes to see how those other factors play into factors, like when I tell someone, so we know that our low back pain is impacted by if we've had a previous injury, if we've had a previous trauma before, our socioeconomic status impacts how we perceive pain, or at least our experience with it. If we have some type of mental health things, it has an impact on how we feel pain. And we can go through a long list of things. And initially, a lot of people are like, oh my gosh, like that is so many things that can make my back hurt. And I try and flip it and say, really what it is here are all these opportunities or these places that we can make a little step to hopefully make this whole thing move forward and get better. And when you open up their eyes to the opportunities for health, for that type of proactivity, you can totally take their quality of life, at least in my mind, and bring them to a whole new place. And I think it's super important for people to have those check-ins, whether it is with a chiropractor or a PT or some type of counselor or psychologist, or, you kind of mentioned earlier, like the spectrum of counseling, right? There are so many different options out there. You just got to find the right fit for you and make sure that it is a place where it's safe. You're in tune, you feel connected, you feel heard, and that you can keep taking those steps forward for yourself.
So, what do people look for? I have, I don't know, the privilege of having had chiropractic care, really just kind of a part of my life since, like grade school age. Sure. I was in martial arts for a lot of years, and there's I would say maybe there was a higher level of acceptance or encouragement for holistic health and wellness within that community of martial arts. And so things like acupuncture, acupressure, chiropractic care, like these things were much, much more like just commonplace. And this is a while ago, 30 years ago. And so while those things seem more at the forefront of like alternative options from like going into a primary care doctor, which I think is super, super important. People still need to utilize and access primary care medical services. But what we're talking about is kind of in addition to that. And so I guess I kind of have just grown up knowing what to look for. My dad went to a chiropractor for a long time in his life. And so I just started going at a young age. And so that's kind of already just been in my mind. But for a lot of people, that's maybe not the case. And maybe they've had limited or no experience with it. So yeah, help us out. Where do they even start? What do they look for in trying to discern what kind of care I should engage in?
I think one of the best things, and I'm trying to think of like how to effectively do that, is, look for the community that ends up being created around that clinic, right? Like, do people go into this place and do they seem to walk out having the experience that you think you're looking for, right? And I think the big thing is like, go to some place that'll listen. And I tell everybody too, people have questions like, hey, my mom or a family member or friend has this going on. Do you think they would benefit from this or not? And I tell everybody, like, call, schedule a time, and we'll just sit down and talk. And people within it then all of a sudden can give you some probably much broader guidance in terms of that situation. And now that next step gets much smaller. But like chiropractic is a good example. Within our profession, we have sports chiropractors, which is kind of what we, put in air quotes, specialize at our clinic. There are people that specialize in child care chiropractic. There are people that specialize in more of a radiology side of chiropractic. There's people that specialize more on like the rehab, or what I would say like PT side of things, where it's, maybe less adjusting or certain things. There's chiropractors that only do acupuncture. One of the cool things that's come out of the pandemic is there are chiropractors that only do telehealth.
Really?
And that is very mind-blowing for a lot of people. But to me, it's a cool example of like, okay, if they're not going to physically adjust someone or do soft tissue work, but they can still get people better through education and instruction, holy cow, like that is a really cool tool that we should be utilizing. And so, I guess do your investigating on people's websites or ask people.
Are there any credentials specifically that people should look for?
There are. So there are certain certifications or whatnot for those specialists. Most don't have them. So if you're able to say like, hey, I'm an athlete, I do sports things, I want somebody that knows sports stuff.
Yeah.
Look for someone that it's a CCSP certificate behind it. But most people on their website, they'll show it.
Yeah.
Right. Because I think from a business standpoint, we want to create a specific community, and those are typically the people that we want to work with and help. So it'll probably be projected in some way. So I think most people end up doing website stuff, but the other thing is just listen to people.
Yeah. Yeah.
That's where I would say 90% of the patients that come to my clinic are because of people that come to the clinic. And that's kind of, we set it up that way almost on purpose. Like I don't want flashy lights to get people's attention. I don't want fireworks at the front door. Like I don't want that stuff. I want people's experience and what they seem to get in terms of the value that we add to kind of speak for it.
Yep. Yeah. Yeah. And I mean, as I've moved around in my life, it's been both ways that I've accessed services is word of mouth, especially when I was back in Sioux Falls, like there's an awesome running community, and, like runners just talk, and they're like, oh, I was having this thing and I went to see this person, and, and it's like that was how I got connected with providers there. But then there have been other times where it's like, I'm new, so I'm just looking up, I'm going online and I'm reading about the services that they provide. And yeah, exactly what their target audience appears to be based on the services that they're providing and the language that they use. And so that's I think both really good pieces.
Yeah. I guess another example of that is, I guess my other advice is ask questions. That's the big thing. And you'll be able to tell right away by how someone either answers your question or responds to that, whether it's going to probably be a good fit for you or not.
Yeah.
And I had a patient come in this week for the first time to our clinic, and they came in and literally said, I am chiropractic shopping. Like, I just want you to know that I'm in the area and I'm looking for the right chiropractor for me.
Yeah.
Awesome. And my response to that typically is, let's find it, whether that's here or not. I'm not going to be the perfect clinician for everybody. And I'm okay with that, but let's find you who is.
Yeah.
And, hopefully you enjoy it and you stay. But if you don't, also getting them to that next place is also a service.
All right. I got another curiosity question for you that, there's a lot of at-home things that folks can do, like foam rolling, even, there are tools that are sold that do Graston essentially, but they're kind of Graston at home type things. There's things like Theraguns now. There's acupressure mats and all these different kind of at home tools. I don't know. Do you have input in that whole kind of market of at home kind of self-care things?
Yeah. So I guess first what I would say is I get really excited when people just want to do self-care. So if there's ways that we can encourage them and do it, and also do it in an ethical way and in a way that makes sense with their understanding of the process, awesome. I get questions all the time like, hey, my uncle has an inversion table and he lays upside down for 5 minutes every day and he loves it. And then they're like, should I do that? I don't know. Maybe. Yeah. They work really well for some people. They really work not well for others. So it gets into that self-experimenting of how does my body respond to this? Because if someone comes into my clinic and says, well, when I go do my inversion chair at home, I'm able to do 95% of the things that I want to do in life. Why would I ever want to take that away if they're not risking something, if they're not losing something to that? And it puts them in control.
Yeah.
So a lot of that, the golden answer of it depends. But I tell people, if it works for you and you're really in tune to things and you have a good enough understanding to make that decision, awesome. Go for it. I think more people need to do that in general. Yeah.
No, that's something, that I have definitely grown kind of into over time, where it was I wasn't, I would say for a long time, I was not sharing very much responsibility with my providers. I was kind of giving them a lot of responsibility for making sure that I was okay and kind of taking care of Ben. But over time, I've really taken on more responsibility with that and tried to be more educated and say, okay, well, and sometimes I still mess it up, that I was using my Theragun the other week and I went overkill and totally popped one of my ribs. And that was, happens. So it's not a perfect thing, but I think for me, it's thinking about sharing that responsibility that when you go to somebody that you're seeking services from, that you aren't looking to them as the answer. Yeah. But that you have some responsibility there as well. And there are things that you can do at home and make that investment in yourself, essentially, to be able to do some of that self-care as in a more routine way.
Yeah. And kind of to the self-care point of when, people might mess it up sometimes, fail forward.
Yeah.
Right. Learn.
I did.
Yeah. And
painfully.
Yeah. Right. And then hopefully we make a different or a better decision the next time.
Yeah. 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 No, I'm not getting rid of my Theragun. I love that thing. Yeah. So it's
good.
Yeah. And they do not sponsor the podcast. So it's
not yet.
Right. But if you're looking for a sponsorship, Theragun.
Exactly.
All right. So Luke, if people want to get in touch with you, maybe they have some follow-up questions, maybe they want to seek out services with you. What's the best way to get in touch with you or learn more about Kinetic, those kind of things?
Sure. So I tell people, if you're interested in clinic stuff, just call the clinic. That's really the easiest. And I'm always open to setting up a time for a phone conversation, or if someone wants to just come in and talk. I do my best to manage that time effectively. But call us at the clinic. The number is 507-345-7836.
I'll link all this information, any that you have in the show notes so people can access that.
Yeah, perfect. My email is drweber@kinetic-chiro. So, unfortunately, we live and die by email these days.
I know.
I would much rather have a face-to-face conversation. Those are probably the two best ways. I guess follow us on Instagram. I'm never on Instagram. It blows my mind how big of a thing that is, but we try and share some good stuff.
Yeah.
Let people know kind of what we're a part of, who we're doing work with, just other things that we're involved in. So that's probably the best. You can also catch me on a lot of different pool decks, depending on where you're at. But yeah, contact-wise, that's probably the best.
Cool. So you're looking ahead at a new year here, 2022. What's on the horizon for you personally, professionally, that you're looking forward to?
Sure. Golly, I love these short questions. They're great. I guess the biggest thing for us, so I purchased the clinic that I'm at about 7 months ago. So 2021 was very much, hey, let's get through the year and just figure out what it looks like then. Now that our feet are settled, we're just trying to, what I think is a really good thing at the community, and just grow that we have our own community, but we want to grow that into the bigger community of Mankato.
Awesome.
It's super cool to be back home and to do that stuff and just to have a totally different viewpoint on things. But now we're just looking to get connected, do more things like this. I'm super pumped that this is my first podcast to be on, and I'm going to be on another podcast on Sunday. So it's one of those things of
cool.
You open the door, you let the universe do its thing, and good stuff happens. So we're looking at that stuff, looking to get connected with other clinics in the area. Again, I'm not going to be the right person for everybody, and that's okay. I also don't have all the answers. There's lots of people that are way smarter than I am. So the hope is we surround ourselves with those people and just continue to learn. I hope my clinic looks different every year, because that means we're changing, we're updating, we're hopefully doing something better. And again, going back to the point of, I never wanted to be a solo business owner. I never wanted to work by myself, but here I am. I would love to grow a team. I'd love to grow other people. And that doesn't even have to just be in the physical health world. Some of the best conversations that I have is with other people in the mental health space, and realizing there is so much between us that we can do if we're open to it. I just finished reading a book called Range by David Epstein. And the big thing that he talks about in that book is, right now we live in a world of just super specialization. And because everybody is in their silo of expertise, that's all we see. And we miss so many of these low-hanging fruit, and these would end up being simple solutions because we can't quite look around. And the goal is to always continue to develop that.
Yeah. My funny story about over-specializing when I worked at the hospital, this was actually at a Christmas party. One of the physicians in the office that I worked in, her husband was a physician, I think cardiology or something like that. And older guy, had been around for a really long time, just excellent, but had no problem ever talking about his opinions on things. Sure. And he was like, the problem with these new doctors that are coming in is that they want to over specialize. And so what you end up with, is somebody coming into your hospital that wants to be a pediatric left eye doctor. Right. And it's like, I only want to see left eyes, not right eyes. And it helps me put things in perspective and step back. No, we need to have a broad understanding of our health and wellness. And so I've just so appreciated our conversation today, Luke. It's been wonderful having you here. I hope that we could do this again in the future. I think this is a great collaboration. So it's just been awesome. Yeah. Really grateful. Thanks.
Yeah, honored to be here. Absolutely.
A big thank you to Dr. Luke for joining the WellMind community, and thank you for spending your time with me today. If you enjoyed our conversation, please check out previous episodes and click rate and subscribe through your podcast app. Let people know about the WellMind, and Maybe share the episode with someone you think might enjoy giving it a listen. Please check out the links in the show notes for Dr. Luke's website and socials. Many thanks to the staff here in the Bethany Lutheran College podcast studio. It's great having you on the team, Matt. And thanks to Lauren McMacken for designing the logo and cover art. Thanks again for listening, and until next time, be well.